Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today's episode is packed with two huge stories. First, a stunning shift in COVID vaccine guidance coming from the FDA. Then, a massive House budget bill that could reshape Medicaid and Medicare for millions of Americans. Let's get into it. Last week, the FDA made a surprising announcement that could reshape how the U.S. approaches COVID-19 vaccination going forward. Instead of the usual advisory committee review and CDC guidance process, two senior FDA officials, Commissioner Marty Makary and his new advisor, Vinay Prasad, announced a significant policy change through an op-ed in the New England Journal of Medicine and a live-streamed FDA event. Here's what's changing. Going forward, COVID-19 vaccines will only be recommended for people over 65 or those with at least one chronic condition. For healthy younger adults, the FDA will no longer support widespread annual boosters unless vaccine manufacturers conduct new placebo-controlled trials after a new variant emerges. That's a major shift, and it's sparking strong reactions across the public health community. Let's take a step back and break down where both sides stand on this issue. First, the case for the change. Supporters of the new policy say this move reflects how the situation has evolved. After 4 years, much of the population now has some level of immunity, either from vaccination, past infection, or both. Hospitalization and death rates have dropped significantly for most age groups, especially for younger adults. Prasad and Makary argue that continuing to recommend COVID-19 vaccines for everyone without fresh trial data risks eroding public trust. They want to see more rigorous evidence for future boosters, especially for low-risk groups. Requiring new, randomized, placebo-controlled trials, they say, restores scientific standards that were temporarily relaxed during the emergency phase of the pandemic. Other countries, such as the United Kingdom, have already moved in this direction, targeting vaccination efforts towards those highest at risk and moving away from universal booster campaigns. The new FDA guidance also emphasizes individual choice. Healthy adults under 65 could still choose to get the vaccination if it is available, but the government would no longer actively promote it unless new evidence emerges. On the other side, many experts are raising flags. First, the process itself has raised some eyebrows. The decision wasn't reviewed by the FDA's Vaccine Advisory Committee, or VRBPAC, or the CDC's Advisory Committee on Immunization Practices, known as ACIP or ACIP. Both of which have traditionally played central roles in vaccine policy. Those meetings are public, transparent, and bring together independent experts to weigh the evidence. They often even bring in the patient voice. Skipping that process creates concern about a lack of scientific consensus and raises questions about who gets to make those calls. Further, critics point out that requiring placebo-controlled trials for variant-specific boosters may not be realistic or ethical. Variants emerge very quickly, and by the time a trial is complete, the virus may have moved on. And giving a placebo to people at risk when a safe and effective vaccine already exists could cross ethical lines. Also, while most younger adults are at low risk for severe COVID-19, many do live with chronic conditions that make boosters beneficial, and some might not even know they're at risk. Blanket messaging could lead to confusion and reduced vaccine uptake among people who might actually benefit from it. There's also a concern about the ripple effect. ACIP had already planned to meet in June to discuss updated booster guidance based on real-world data. This FDA announcement may make it harder for the CDC to issue independent recommendations, and that tension could undermine public trust even further. So where does this leave us? This is clearly an inflection point. On the one hand, the pandemic has shifted, and a more targeted, evidence-based approach does make sense. On the other hand, trust in public health depends not just on outcomes but on the process involved, and many experts worry that this change was made too quickly without the kind of robust debate the public deserves. It's a reminder that how we make policy is often as important as the policy itself. Well, while all eyes were on the FDA's vaccine policy change last week, another major health policy story broke, one that could affect tens of millions of people who rely on Medicaid. The House of Representatives passed its fiscal year 2026 budget resolution, and buried in that bill are some dramatic proposed cuts to Medicaid. Here's what's in the House plan. First, capping federal Medicaid funding. Instead of matching state funding, as is the current law, the federal government under this bill proposes to send states a fixed amount, either through a block grant or a per-person allotment. Second, there would be new work requirements for adults on Medicaid. And third, there would be limits on Medicaid expansion and potential rollbacks of coverage for low-income adults. Supporters of this bill argue that these changes will rein in federal spending and give states more control. But health policy experts warn that the impact could be severe. If these proposals become law, states could be forced to cut services, reduce eligibility, or limit provider payments, making it harder for people to get care. And remember, Medicaid covers more than 80 million people. That includes children, people with disabilities, and older adults in nursing homes. It's the largest source of coverage for people with chronic illnesses, mental health needs, and with long COVID. The House plan is not law yet. It now moves to the Senate, where it faces a much tougher road. Senate leaders have already signaled that they won't support these deep cuts, especially without bipartisan input. But that doesn't mean patients can afford to tune out. So what can you do? Well, if you rely on Medicaid, or if you care about someone who does, now is the time to speak up. Call or email your U.S. senators. You can find their contact information at senate.gov. Share your personal story or concerns about how cuts to Medicaid would affect your family or your loved ones. Watch for public hearings. Senate committees may hold hearings on budget priorities in the coming weeks. These are opportunities for patient advocates like yourselves to submit written testimony and attend virtually. Stay connected with advocacy organizations such as GHLF, and we'll take the fight to Washington for you. Lawmakers do listen to their constituents, especially when real people explain what's at stake. And while it's easy to feel like these decisions are out of our hands, public pressure matters, especially in moments like this. We'll keep tracking this story as it moves forward. That's all for this week's episode of The Health Advocates. We covered a lot, from a sudden pivot in COVID vaccine policy to a budget bill that could reshape Medicaid and Medicare for years to come. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.